Hi, Dr. Carolyn Daitch. Good to see you this morning. I'm looking forward to talking about our workshop and our conference coming up. It's going to be in May from 9 to 10th May 2025 in beautiful Banff. And you've graciously agreed to come do a training for us, and we're looking forward to that. It's going to be on anxiety, clinical hypnosis for anxiety, and we're here to learn all about it. So I'll ask you a few questions. Maybe you can tell us what people can expect to learn and what they'll be focusing on.
Thank you for asking me that question, and thank you for inviting me to Banff again. Been there once before for your society, loved it. People are so nice, so I'm delighted to be coming back. What can they expect? Well, they can expect practical applications to the treatment of anxiety with hypnosis and also some mindfulness and cognitive therapy, my integrative approach that I use. And they're going to be able to go home with tools that are easy to learn and easy to apply that they can use right away with their patients and clients.
That's wonderful. I know a lot of people really like that. They like having practical skills, tools that they can use right away. That's fantastic. And maybe not enough people know about you and about your training and your experience. Maybe you can tell us a little bit about that.
There's a lot to tell. You can look on my website, carolyndaitchphd.com, to see more than you even care to know. But I've been working for a really long time, and I've literally seen thousands of clients over the years, many of them who come in to deal with emotional reactivity, anxiety, and relationships. I've also been busy writing 4 books that have been translated into a couple different languages and several articles for professional, particularly the American Society of Clinical Hypnosis has published a number of my articles. So I've been doing a lot of work in this field for a long time. I really like to train people. It's one of the most satisfying things I do. I like to share my ideas with other people and learn from them as well. Every time I do a training, I learn from the people who participate. And it's been quite an honor not only to present in many places, but people who read my books have influenced their clients in many countries that I haven't been to.
Yeah, that's fantastic. Thank you. And yeah, I'm aware of some of the roles that you've played with the American Clinical Hypnosis Society, which is really great. So with our session coming up, our workshop and our conference in May 9th to 10th, 2025, we'll be having some participants. Now they'll need to have their level 1 clinical hypnosis at least. That's the kind of the bare minimum. But other than that, who should come? Who do you think should come to learn some of these skills?
Well, as you say, they have to have a little bit of training, level 1. They don't need to be advanced. It's applicable to any fully licensed or partially licensed professional, not only psychologists, but also counselors, social workers. If you have marriage and family therapists there, they can come. And I also teach to people who are physicians. I'm teaching to somebody right now who's a gynecologist, a gastroenterologist. I've had cardiologists. I almost always have dentists. I teach to physical therapists. So it can be really a broad range of people. So for
Any health providers that like can talk to clients, and in most settings, there'll be some anxiety that they see at least in some of their patients.
exactly. So it
Yeah.
doesn't necessarily have to be clinical therapists, although the large portion of people who come usually are. But I always get people from other professions, and certainly the physicians and the dentists and the physical therapists. And
Yeah.
then nurses, I forgot nurses,
Yes, that's
nurse
true.
practitioners,
And
yeah, or
psychiatrist,
physician
yes.
assistants, definitely psychiatrists. So it's applicable to a broad range of licensed professionals. And it makes it
Awesome.
more interesting for the group if
Yeah, it's true. You get different viewpoints as well. Thank you. And now we're going to be having this live in Banff. There's also going to be a virtual option to attend virtually as well, but we're going to be having it live in Banff from May 9th and 10th, 2025. And we're also going to be having a consultation opportunity as part of the attendance, as part of the participation, 3 to 5 to 6 weeks after, so that people can try these skills, work on them with their clients, develop some experience, and then come back with some questions, get some follow up, get some consultation from you. And maybe you can share a little bit about that part. I'll just mention it'll be like a 3 hour consultation with you, and maybe I'll let you speak a little bit more to that.
Thank you for asking me about that. I've never done it quite like this as you're describing, and I think it's a brilliant idea because people will practice and then inevitably they have questions. They have questions how to apply these techniques to some of their more challenging clients or patients. So it's a really good idea. And people come after my workshops to mentoring and that kind of thing.
Yeah,
It's
and
great.
that's part of the program. It's free. It's part of the program. So when they participate in the ninth and 10th part, they'll be invited to come to this part as well. Well, that's wonderful. It was really good to see you, and thank you for your time to talk about these details of the program. I can't wait to see you in May and everyone else that's going to be attending as well.
My pleasure. Looking forward to it.
Okay, take care. Bye.